First off, men are concerned that the brachytherapy implant procedure that we do is a major operation, just like having their prostate removed. So to back up, the way we put the seeds in the prostate with a permanent implant, or the hollow catheters that are used to administer something called high-dose rate brachytherapy, the seeds or the catheters are placed through the little patch of skin where men sit. So we call that the perineum. And so in doing that, there is an anesthetic required, because otherwise it might not be very comfortable. And so, but the important thing is it does not require any incisions at all, and it does not require an overnight stay in most patients anyway, at least with the seed implant. And basically the recovery time is quite rapid, so we always have to distinguish it from a radical prostatectomy or another major surgical procedure, for example. The other thing that men are fearful of, and we need to talk to them about, is pain, sort of related to that. So they're worried it's going to cause them a lot of discomfort, and we need to reassure them that it will not. Another thing that they need to know that they are concerned about is being radioactive. So brachytherapy is somewhat different than external beam radiation therapy in that regard. Seed implant involves placing radioactive seeds inside the prostate. At least they're radioactive to start. Any radioactive material tends to lose its radioactive material over time. Most centers will put in a particular isotope of iodine called iodine-125. And if you think back to your high school physics or chemistry, you will remember a term called half-life. So the half-life of this particular material is 60 days. Functionally, what that means is most of the radiation is out of them within 6 months, and all of it for sure is out of them within 18 to 24 months. To be extra super-duper careful, and this is how federal governments are, the federal government mandates us to say the following. It says that two things. Number one, that fetuses, so babies that haven't been born yet, are especially sensitive, and also young children are especially sensitive to low doses of radiation. So the guidelines say that men should not have small children sitting on their lap for the first 2 months only, not forever. Some men worry about that I'll never be able to read to my grandson again. That's not true. Just for 2 months. And so basically the grandson cannot sit on the lap for 2 months only. The other thing is that you are supposed to be at least 6 feet away from somebody who you know is pregnant. If you accidentally walk by somebody at the mall who's pregnant, you don't need to chase after them and say they're in danger or whatever. But basically, if you know your daughter-in-law is pregnant, then, 6 feet. And if you think about that, 6 feet's actually still pretty close, so you can still go to the barbecue or whatever. You don't need to lock yourself away and not do anything, because you're not that dangerous to people. The other thing that men worry about or have to talk about is that somehow I have to go in and take the seeds out later involving another operation. I do not have to do that, because the metal seeds, even after the radiation is gone, don't hurt people. They can stay there. They're platinum. They're inert. I like to joke and say that people are especially valuable after the seeds are in there. But basically, the seeds don't need to be taken out. They just sit there. The only thing about that is kind of interesting, but also in common with some other medical procedures, is the metal in the seeds that remain in permanently can, not always, but can set off metal detectors at airports. And so we give people some information just in case that happens. But they're quite used to that because people have hip replacements and other things with metal in them. So other than that, they don't need to worry about having these seeds, quote, taken out later, end of quotes. Another final thing men often are thinking about, and this is actually a reasonable question, is, okay, if I have any of these treatments, and in this case we're talking about brachytherapy, and the treatment doesn't work, the cancer comes back, what do I do? And that is an important question to ask your doctor if an option on the table for you is brachytherapy. The answer you'll get may vary a little bit, but one thing that is true is that radiation of any sort does influence our enthusiasm for trying to take the prostate out afterward. And that's for two reasons. One is trying to do surgery after brachytherapy or external beam radiation therapy is at least to some extent more difficult. Maybe even a little more importantly, the healing isn't as good, and so the risk of incontinence, if you're doing surgery after radiation of any sort, is higher. And so it's mainly for that reason that we don't like to do a lot of surgeries after brachytherapy, or for that matter after external beam radiation therapy. So that will be one thing to kind of ask about. How that factors into decision making varies as to the case and how the individual feels about it. Because some men will hear, in their particular case, perhaps that the cure rates are very good, and so there's this idea in some cases that the possible need to do some sort of treatment afterward is much less because the cure rates are high in the first place, just as an example.